3 years since a public health emergency was declared over the U.S. Over coronavirus, and now President Biden announced that emergency will come to an end. The White House telling Congress the emergency declarations will expire, on May 11th, a major move that will change how the government responds to the outbreak. So we have Dr. Jane Morgan here, the executive director of the COVID task force at Piedmont Healthcare here in Atlanta. And you've been here along the way, you know, coming in, or whether it's virtual a lot of times because of the pandemic. But where would you say we are in this pandemic? And is this the right move to make right now, 3 years later?
And so when we look at where we are in the pandemic, we look to the World Health Organization. And this 18-member committee decides really whether we have a public health emergency or whether we don't, whether they declare that we'll be having one or whether it will be ending. And they look at a number of criteria. So they look at the suddenness, the seriousness of the pandemic. They look at how likely it is to spread and what is the likelihood of taking immediate action. And then they also look at things like vaccination status and therapeutics being available. So when you look at the whole compilation of that, you can see that it's starting to move towards more and more of the tail end of this pandemic. And certainly when we look at the burden of disease that we've had in 2022 with our winter surge, which actually was less than the winter surge of 2021, it is clear that we're starting to get to the tail end of it. Of course, the variations are always the X factor, the unknown factor, and so we'll have to wait and see.
And that's what I was going to ask. I mean, is this something that, I mean, we're just going to have to wait to evolve, essentially, right? I mean, are you thinking that, you know, we're going to have this vaccine as common as our flu shot every year? Is that what it's going to look like, probably because of these variations?
And so it does look as if we're moving towards an annual vaccination, and there's some pushback from the scientific community because, as you know, with the flu vaccine, we anticipate what the variants are going to be that are circulating. Some years we do better than others with the flu shot. COVID will actually be the same, but it appears, with our experience with the SARS-CoV-2 virus, that it evolves more rapidly than the flu. So if we wait for annual shots, we may actually even be more off the mark than we are sometimes with the flu. And so maybe they need to be biannual shots such that we can keep up with the evolution of the variants. That conversation is also going on with within the scientific community.
And that's such a good point because when it comes to the flu, people will say, people that I know, I'll speak from experience, people that I know, they'll say, you know, well, we don't know how accurate the flu shot is, right? Because there could be different strains and, you know, you could get a different strain. Do you think, though, that because this virus does mutate so quickly, like you were saying, that vaccine confidence could go down if we do wait for that year period?
So I think vaccine confidence is a great topic to explore. We probably don't have enough time to uncover it here, but there has been so much malfeasance and maybe undermining of the scientific voice and scientific integrity. But we have to understand that by and large, the influenza vaccines are very, very good. And in fact, this year has been one of our better years. It has been incredibly accurate. And so we have to thank science for how we're able to not only learn the lessons from the past, but then anticipate what the circulating variants are going to be. And by and large, it's pretty accurate. Every now and then we have an off year. This is not one of those years. This flu vaccine is actually very accurate.
Good. So when these emergency orders are lifted and when they expire, what are some of the things that Americans are going to see change?
So one of the things we see with the public health emergency, we have protections for the availability of therapeutics. So vaccines are available. Moderna agreed to let its patent be available for its messenger RNA vaccine, so others can apply and make generics of its vaccine. Pfizer had the same type of pledge. Merck with its Paxlovid, the Molnupiravir, the anti-COVID pill as well, has made that similar pledge. So all of that will go away once the public health emergency is lifted. Also the access and availability, which is a big concern. And certainly these have been, by and large, made available for free to the public. And we will run that clock out with public health emergency ending. The other thing to think about is the availability of telehealth, and that also has been available under the public health emergency. Millions and millions of people, certainly the elderly, have taken advantage of public health. of telehealth with the public health emergency. We do see with the Consolidations Act that telehealth will be protected through December 31st of 2024, regardless of whether the public health emergency ends or not.
So do you have any concerns then with this expiring, whether it comes to that telehealth aspect or it comes to vaccine availability or having to pay for the vaccine?
So absolutely, I have concern. One of the concerns is that people have not stepped up to get the new bivalent vaccine. So we're at probably 15% uptake. And so that is of concern. That's probably a greater concern to me than the public health emergency, whether we are lifting it or not. The other thing that is of concern is our pediatric population, our children. Our children still have their immunizations against COVID much less than immunizations against any other disease that they have. So that COVID
and why do you think
vaccine
that is?
uptake, again, I think it is somewhat of the reticence and concern that parents have. And also I think the minimization of the seriousness of these particular circulating variants. And so we see that in the pediatric population. We see that COVID still remains the #1 cause of death in children, and yet we still see that children are the lowest group of all types of people to have this vaccine at less than 10%. So the pediatric population is still a concern, and I think that's independent of the public health emergency.
Okay, that's what I was going to ask, if you think that the public health emergency being lifted, if that's going to hurt or help the seriousness factor, because that was an interesting part too that you just said.
Exactly. You know, how serious are we taking this? And one thing that we have to think about with the World Health Organization, even the United States, the United Kingdom, if we're going to lift the public health emergency, the PHE, oftentimes this is not a scientific threshold. This is a social and political consensus-driven opinion. Predicated on some of those factors that I've already mentioned with regard to immediate action and spread and seriousness. And so there really is no scientific threshold as we move through this. We expect that the pandemic maybe will officially end in March of 2024, so we are maybe still scientifically a year out ahead. But certainly as we look at this winter surge, it does appear that we're on the tail end of it. Again, the X factor is what the variants will do.
All right, still questions. As